If the patient's chest is not moving, you need to check the patient, check the ventilator manual switch, check the bellows and circuits, and check your settings. One reason might be a circuit leak. When this alarm sounds and the bellows are not refilling after every breath, you have to suspect a leak. First, check the patient and then follow the circuit towards the anaesthetic machine. Look for any disconnection. Here is a disconnection on the inspiratory port which would cause a massive leak. Reconnect and watch the bellows gradually re-inflate. If this was a COVID-19 positive patient, you would first of all turn off the ventilator to prevent any spray, and then you would look at your patient before checking over the circuit to find and fix the leak. The reason for the patient's chest not moving could be that the switch is set in the manual rather than the ventilation position. Please also note that the apnea alarm on this anaesthetic machine is very quiet. As soon as we flick the switch to the right, ventilation commences. Another rare but possible problem is the failure of mains oxygen. This alarm sounds and an emergency message is displayed on the screen. The ventilator cannot operate without compressed gases, and we need to open the spare oxygen cylinder on the back of the anaesthetic machine immediately. This stops the alarm sound, but a message indicating low supply pressures of oxygen remains on the screen. If the spare cylinder on the back of the anaesthetic machine is empty, or not working, or not available, then we need to use our spare CD cylinder. In order to access this, disconnect the mains pipe from the main socket and insert it into the Schrader valve of the CD cylinder. Also, do not forget to turn it on with a black wheel on the right hand side. Oxygen and air are mixed electronically in order to achieve our desired FiO2. This also can fail. Should this happen, the emergency alternate oxygen control on the front of the anaesthetic machine needs to be activated. In order to do this, press the little button and turn the manual flow meter to full, which is 10 liters per minute. A message on the screen will confirm the activation. We'll now need to attach the patient to a different ventilator, for example an oxylog, and check the anaesthetic machine. If you have pressed the button by mistake, this is easy to reverse. You just press the button again and close the flow meter. Following this, you need to confirm this on the screen by pressing the end alternate oxygen control. It is very important to note that the machine defaults back to a flow of 2 liters per minute and 100% oxygen. This flow is too low to prevent rebreathing of carbon dioxide in intensive care use when soda lime is not part of the circle system. We therefore need to increase it again back to the previous levels. If you're in a hurry, just press the 10 liters per minute button. The FiO2 can then also be adjusted either with the buttons or with a green wheel. I would also like to mention that it is not possible to perform maneuvers such as an inspiratory hold or expiratory hold for plateau pressures or total PEEP on the Aisys CS2. If a plateau pressure is required, for example to calculate driving pressures, it is possible to switch to volume control ventilation. In the ICU setting, this has an end inspiratory pause built in by default, which will give an estimate of a plateau pressure. You have now reached the end of this training video. If you have any further questions, please look on the intranet or contact the on-call consultant in critical care.